I'm Christine Grumping. I'm a family nurse practitioner and I'm certified in menopause care. I also do weight loss management.
My name's Andrea. I'm a women's healthcare nurse practitioner, primarily do women's health, but kind of the full spectrum of women's health as well.
And I'm Jocelyn, and I am a family nurse practitioner and have been in the women's health space for a few years now.
And Jocelyn and I are both menopause certified. We forgot to say that.
We're going to be talking about our new segment called Shady or Safe, where we talk about some of the, how do we say it, like common hype treatments in the menopause space right now. We're seeing a lot of it on TikTok and on social media, but it's not always recommended. So we're going to be going through what is standard of care, meaning what is best practice for menopause treatment, and then maybe different from what your girlfriend's telling you to go see this other provider for, or what your other provider is recommending. So who wants to start off? Jocelyn, Andrea?
Sure, yeah. So, I see a lot of patients that come in and are saying how they have tried pellet therapy, how their friends did really well, and, for whatever reason, they're just not feeling well. Well, the thing with pellets is that it's really hard to have a standard throughout. Each clinic kind of practices as they do. And you can have such inconsistent levels of hormones, really high levels of hormones where it's dangerously high. And it's, you have it inserted and you have it for 3 months. So it's kind of hard. You're kind of in for that ride. And overall, some people can do okay, but you do see a lot of patients that can have a postmenopausal bleeding because their estrogen levels just too high. They're not getting, proper progesterone. Their testosterone is really high. They have acne. They have hair loss. So it's one of those things that it is not standard of care. A lot of the national organizations truly are not for pellet therapy. And again, it's not FDA approved. So it is very expensive, be inconsistent. And then the effects of it can be either long-term, just not great again. So something to consider is just to have a provider that that is following standard of care when it comes to hormone replacement therapy.
Andrea, why do you think if it's not standard of care, why are providers recommending it?
Well, it is very expensive, first of all. So I think there can be a lot taken off of the top from an office to make this a really profitable method of treatment for patients. Pellet therapy has been around for a really long time. A lot of people are familiar with it. And I think because people are familiar, they think it's safe, but that's not necessarily the case. And to Jocelyn's point, to understand like the administration, you get, this medication put with a needle underneath your skin. You may get like a set dose, but depending on how your body absorbs this, metabolizes this medication, you may absorb this rapidly at the beginning. But if you're only getting this every 3 months, you may finish the effects of this around 6 or 8 weeks. And then technically maybe you're with 4 weeks without really good therapeutic dosing, or you get too much in the beginning and you feel really terribly, and some people can have the effects longer than that too. So with FDA approved drugs, they know what the absorption looks like. It's very consistent. You're getting consistent dosing and you should be getting therapeutic levels throughout. So I just think, it's the familiarity kind of throwing people off. And then again, it's a way for offices to make, good pricing off of it.
Yeah, I agree. I think 9 times out of 10, when I have a client come to my office and they're on pellet therapy, they don't realize that that's not actually recommended treatment. And Jocelyn said it, but just to kind of echo that leading medical organizations like ACOG and NAMS, the Menopause Society, even endocrine societies around the world actually recommend against pellet therapy. So I wasn't able to find any that recommend for it. It's not FDA regulated. And there were actually 4,000 reported cases in California in 2019 against a pellet therapy compounding company that led to some pretty severe outcomes, cancer, stroke, and infections. And they found that they were being produced in a non-sterile lab. So there are some, really serious considerations when you're using compounding. And compounding just means that it's not FDA approved, right? It's made in a pharmacy. It has its own set of regulations, but that's not FDA regulations. And so oftentimes when I see clients that are taking a tincture or they're doing vaginal inserts, I'm not talking about vaginal estrogen therapy that you get from your local pharmacy prescription, or they're doing rectal suppositories or pellets. That's all compounded and it's not regulated. And if your doctor's name is on the bottle, that's a really good indication that it's a compounded medication and that you're not getting something that's been studied. So we don't know if it's safe or effective. And so I think like the biggest takeaway that I try to tell patients is like some of the biggest downsides of this is, one, the cost, right? It's not covered by insurance. Two, it's the added need for regular testing. So getting labs done regularly, which this is part of the model that the provider has to make money, right? They're recommending compounds instead of FDA approved medications because they can make money off patients who don't know that this isn't safe practice, right? And so they're making money from the compound because the compound pharmacy has a set price for the provider, and then the provider adds anywhere from 20 to 30% on top of that, and sometimes more, usually more. And then they make money off the labs. And so there's the set price for the lab, and then they charge on top of that. And then they make money from the regular visits because you have to go in more often when it's not standard of care. So then they're making money off that. And often it's a membership that you're signing up for. There's a local provider who does $1,700 for 3 months of treatment.
Wow.
When when we have FDA approved treatments that are covered by your insurance, labs are covered by insurance, medications covered by insurance. A standard visit that's not covered by insurance should be like $200 for a first visit, not $1,700. That's crazy. So anyway, if it has your doctor's name on it, it's compounded, and it's compounded because they can make money off of it. And the other thing is just, you should ask them, why are you recommending compound or pellets over an FDA approved option, and see what their answer is. Because the only time you should really consider compounding is if, and there are times, like for example, a testosterone, right? There's no FDA approved medication for testosterone in women. And so we do have to get more creative with testosterone. Cream is usually first line because it's the safest option. And then, there's like weight management's another really great option where if you can't get coverage for Zepbound or Wegovy, you're looking at $1,000 to $2,000 a month for that medication. Compounding brings it down to around $200 a month. So finance can be a big part of it, right? So those are usually the two times. And then, for example, if somebody has a peanut allergy and they can't tolerate micronized progesterone, you could consider a compound version where it doesn't have that potential allergy. But if you haven't tried FDA approved options and the provider is going directly to compounding without having that discussion, that's usually a red flag. And I would hope, have you pause and say, let me think about this. And then you go get a second opinion from a NAM certified provider to see if you're getting the right recommendation and care. Or if maybe it's a biased provider who's trying to just make profit over safety.
And on the note of safety, some providers also do compounded progesterone cream. And that isn't really well absorbed. And progesterone for a woman that has a uterus is of utmost importance because that is what's going to prevent hyperplasia, which eventually could lead to endometrial cancer. So it's very important that we're getting the right progesterone and that it is in fact protecting our uterus. So that's something else to consider when it comes to compounding. And in general, just making sure that it's coming from a good compounding pharmacy. That's also very important.
Yeah, they're not all created equal.
And I wanted to circle back to labs too, because when you're providing FDA approved menopausal treatment, we know what the absorption looks like. We know those are in safe levels if they're administering them in appropriate dosages that are FDA approved. So you do not need labs if you're getting FDA approved treatment. When you're getting pellets or tinctures or something where your dosage and administration can't be guaranteed, your providers are checking your labs because they could be dangerous levels. So getting labs or having labs required for your menopausal therapy should be a big red flag for you.
Yeah, that's a really great point. And with pellets, you're going to have higher than desired levels when you first start. That's part of it. They will account for that. And so, that's a dangerous potential side effect is that you have higher than recommended levels of testosterone and estrogen. And, these medications, part of their property is that they can cause breast cancer and they can cause blood clots. And so when you have higher than indicated levels or recommended levels, that's dangerous.
Is also a lot of perimenopausal or menopausal symptoms can also be shared with other conditions. So sometimes if you're feeling like you're at the highest doses and your symptoms are still present, or you're still having joint aches or whatever it may be, you should go get further evaluated because there could be something else going on and it's not necessarily perimenopause.
Absolutely.
Yeah, that's a really great point. I'm seeing this pattern in Austin where clients come in and they're on testosterone pellets or cream and they're on progesterone, but not like there's no estradiol on that treatment plan. The provider's starting testosterone first, which I think is really interesting since the estradiol is the main hormone that treats menopause. And so just to talk a little bit about what's standard there. So standard would be starting hormone therapies, so estradiol and progesterone if you have a uterus for uterine protection for at least 3 months. That's the typical recommendation. And then you would reevaluate if there's still low libido or HSDD is the diagnosis, if there's still that concern that's not being addressed. And then that's when they would recommend trying testosterone. I just want to highlight that testosterone is it's like the Wild West, right? There's no like standardization. There's not great guidelines out there. We have ISHWISH, which gets as close to, they put out a position statement that's the closest that we have to standardization of treatment. And so, guidelines are really going to vary from provider to provider, but generally what is considered safe is cream if you're going to do testosterone. And you want to do it 1/10 of the dose of what men get in their testosterone. And so that's where a lot of times you will use compounding. You can do 1 click of the cream as opposed to trying to use just like a little bit of, your husband's testosterone cream. It's just really ambiguous and it's hard to use 1/10 of that medication when it's dosed that way. So do you guys have any thoughts on that?
I was just going to say, if you do testosterone, because that is not FDA approved, we know there are benefits in women. That is something that somebody should follow up with labs for your safety. So with the exception of labs, you shouldn't need labs with FDA approved estradiol and progesterone. But if you're adding in testosterone, for sure, your provider will want to monitor you with lab work.
Yeah, with testosterone specifically, you could have like an increase in your hematocrit, so monitoring your CBC, your liver function, all of that is very important.
Okay, that's it for our episode for today. So next time on our segment, Shady or Safe, we're going to be talking about thyroid conditions and, is your provider recommending some shady treatment when you don't really need it? Thanks for joining, guys.
Thanks, everyone.
Thanks, y'all. Bye.
Bye.